Hey guys, Natasha with Earthbound Therapeutics. Today's subject is Tui Na, focusing on the knee and the Chinese meridians and what they do and our focal points and how to treat it, as well as some anatomy and physiology. So here you'll see the muscular system of the human body. We're going to go ahead and focus in and zoom into the knee. And these points will be focusing on stomach meridian 34, 35, Zayan 35, and stomach 36, and urinary bladder 40. So right now we're focusing on the extension digitorum longus. And right there, we'll be focusing on the rectus femoris. And we're going into on stomach 34, and we'll rub that and focusing on the top of the patella on the rectus femoris. And so when we're doing this, located on the thigh, lateral border from the patella, superior and inferior to the iliac spine. That'd be stomach 34. We'll press and hold, then rub, and then we'll come to the tibialis anterior, to sun of the superior border of the patella, and that's going to be stomach 35. So then we'll focus on that. Right now you're seeing the soleus right. And if I can work this accordingly, this is taking me some time. So you'll grasp the quads and the adductors, plucking the quads, and then over the patella you'll also be grasping, and then we're going over to the soleus, digging the fingertips around the patella and doing some plucking motion. You'll grasp the hamstrings and the gastrocnemius. Then you'll start plucking and using friction, lightly rubbing over the popliteal fossa. And right now you'll see the semitendinous and the gracilis. Right now I'm trying to find the adductors. They're kind of up in there, so it's hard for me to click in there. But anyways, so as we're in there, we'll go ahead and come back lateral side, and we'll be focusing on Dubi stomach 35. So the hollow form of the knee is flexed. So we'll flex the knee below the patella laterally to the patella ligament, also known as shinyin, forming medial and shinyin. Right now I can't show that obviously, but moving on to Dubi stomach 35, you'll see the meridian points right here where I put some points of where to press. And before we work on that meridian, just kind of, if it's sore in these areas, just have the chi is stuck, so holding that area, waiting for it to release, and then once it doesn't hurt anymore, then you can start doing some friction and rubbing. Doing Tui Na knee injury, focusing on my live demo. We're gonna do stomach 34, which is Young Chu, so I'm gonna show you that. Do these in steps. So where you'll be focusing is located on the thigh, right here, and lateral border from the patella. Oop, do we have it? Good. Okay. So about right here, lateral border from the patella, and superior, inferior, all the way to the iliac spine. All right. So that's stomach 35. And then you'll just come down here and you'll press and hold and then rub. and that's stomach 34. Okay, next we're focusing on stomach 35, Dubi. So from the hollow form of when the knee is flexed, so we'll flex the knee, and we'll place a bolster or a block underneath. And then from the patella on the lateral side, there's a little indentation, and from the lateral to the patella ligament, you're gonna go to Shinyan and forming the medial side on this side, and you're just going to rub in here. Okay. So all these points, you'll just press and rub, press and rub. And then we'll be moving on to the next meridian. All right, so we're gonna go to stomach 35 and 36 to Shunjuju. So you'll take both of your fingers, measure, and then it's 1 cun from here, laterally, and just press. And it's supposed to come up here to release any tension in the knee. Moving on to urinary bladder 40. Okay, moving on to urinary bladder 40. So using longitudinal strokes on the patellar, we'll do that. But when you're locating this, you're going to find the crease of the popliteal fossa, and right in the middle, that is your point. And he's saying that because it's tender, so we'll press on that to release. All right, so putting it all together, we're gonna grasp the quads and the adductors, and we're just gonna rub, 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 rub. And as you feel the tissue, you'll start feeling things become more loose. And then moving down, we're gonna find that indentation, and then this is what we would call plucking. And then you're gonna go into that area and rotate on each side. Sometimes it's better when the knee's covered. Okay, you'll do that. And then you'll go ahead and grasp around the hamstrings, and you're gonna find that medial fossa in where the crease is, where the gastrocnemius and the soleus, and you'll just press in using friction or light rubbing over the popliteal fossa. And then you'll go ahead and recheck the knee. Maybe check that urinary bladder and stomach meridian. Press on those meridian points. And there you have it. Tui Na, a sports injury of the knee.